Hi, I'm Amy, and I'm going to demonstrate using the push-pull method to draw blood from a central line. I'll start by hand hygiene. Once I've finished hand hygiene, I'll put on my gloves. Now what I have here is supplies to do 3 tubes worth of blood. So when you have 3 tubes, you're going to need more blood than your 10 cc's, so there's an additional syringe here. You're going to look at your blood tubes to see the volume of blood you need. The whole point of this is to not waste blood for your draw, to just take what you need. I'm going to set these 2 pieces aside. I'm just going to demonstrate doing one lavender and 1 green tube. The green needs 4.5 mils. The lavender needs 3. I'm going to pull about 7.5 mils of blood out of my line. So to get started, I'm going to scrub the hub vigorously. And allow that to dry. Once dry, I'm going to attach my saline syringe. Now you're going to flush this entire syringe in here. And what is different is you're going to slowly pull back about 4 to 5 mils. And then slowly flush that back in. You don't want to use that push-pause method. So that was 1 time. We're going to pull back again for a 2nd time. Push it back in. And a 3rd time, nice and slow. And back in. And a 4th time. And the whole point of this is to get a good agitated sample of blood that doesn't have anything diluted. And on that 5th time, you're going to pull back the amount of blood that you need. So I said about 7.5 mils. Nice and slow. We're about there. So at this point, I'm going to unhook this and put my saline flush right on my line. I'm going to flush that first 10 cc's right away to clear the line of any blood, and this I will use the push pause. I'm going to leave that there, get my vacutainer transfer device, connect my blood sample syringe, and remembering order of draw, I'm going to first fill the green. Until it stops, and then the lavender. And the goal is to have little to no blood remaining in your tube. The lavender never seems to suck quite all of that. We'll gently invert a few times, set that aside. This piece will go in the sharps container as there's a needle in there. I'm now going to flush with my other 10 cc's to make sure the line is good and cleared. That push pause method. And I'm going to clamp my line with that last cc or 2 and unhook. So at this point, I'm going to label my specimens, put them in my specimen collection bag, and send them off to the lab.